face down on the table. And I'll do an assessment of his lower back to see if I can see any irritation or how generally it's feeling to me. So, you know, we have the opportunity that we know each other for a while, and he's already explained his problem to me. But he is showing some inflammation in his lower back. He has a very tight lower back. His facet joints are tight, very stiff. He's got some soft tissue swelling in this area. And the overall flexibility is not where we would like it. So our goals would be, can we improve this situation? He's had this condition for a long time. He's had treatment on it in various ways. And so acupuncture is another opportunity and way of seeing if you can improve a condition. There are many different doctors and many different things you can do for certain conditions. All the doctors around, be it a medical doctor, a chiropractor, physical therapist, or an acupuncturist, we all have the same goals in mind. We want to get the patient better. We want to improve the function of the area and help them. But we all have different methods. So a medical doctor might give you medication for it or a prescription, or he might send you off to get special diagnostics done. Chiropractor, we do the same things with diagnostics, but we treat the spine and we try to improve function by improving spinal alignment and nerve function. Physical therapists might put you on a regimen of exercises that are appropriate for your condition. But acupuncture is a different way of approaching it. And to understand that, you have to understand that the philosophy of acupuncture is very old. It's thousands of years old, developed by primarily the Chinese. There's Japanese forms of acupuncture, there's Korean, but we all agree that the origin is from China. And in this case, because of the inflammation and the long-term chronic problem of his lower back, my assessment is that he has a blockage of his chi energy here. It's not flowing, and chi energy is the natural energy flow that flows through your body 24/7. And what we look for is if there is a blockage of energy, and we call it stagnated energy, it generally will not allow his back to function the way we would like it to, and he'll end up having long-term symptoms of swelling, muscle spasms, pain for sure. And so our goal is to try to reestablish chi flow. Now, you really do have to kind of accept that there is this magical energy flow through your body called chi energy. And how the Chinese came up with this originally is amazing to me, but we know through modern testing that chi energy does exist, and I call it an energy highway that goes through your body. And in this case, what I want to do with Dr. Hassel is to reestablish better chi through this injured area that he's had for a long time and get it to function at a higher level. And in that sense, his symptoms will be better, his pain will be less, and long-term healing will be possible.
Yeah, that's really cool. When you mentioned that modern science has discovered that chi is real, it brought me back to, I work at a medical doctor's facility, and one of the medical doctors there does medical acupuncture, and it's coming more mainstream, I guess. Because they know it works, right? I mean, it's pretty powerful stuff.
It has become a lot more mainstream, and part of the reason maybe it's taken a while is if you go back to the original doctrine of acupuncture, the Chinese have some kind of funny ways. They call things like circle the dragon, and you have a wind problem or a damp problem, and it's not scientifically, terminology is not scientific, but with, if things work, they work, and if they, obviously if it's been around thousands of years, it's a tried and true method that has shown probably millions and millions of people positive results. So now we're in the modern time where we are now, and we see hospitals using it. I work with the VA hospital, some of the soldiers and retired soldiers there, and they have implemented acupuncture into their treatment because we realized that there is an opioid problem in our country, and that long-term use of pain relievers and things of that nature aren't real effective, and they're kind of dangerous. So they're looking for ways that they could better serve their patients over there, and acupuncture is definitely one of those things. And so I was quite excited when I saw that they were doing that, because it tells me they're forward-thinking and they're looking for ways of best servicing their people in a real positive way that's going to be beneficial to them.
That's awesome. That is so cool. So when are you going to stick me with some needles?